Hi, my name is Lily. I'm going to be your student nurse today, and we're going to do a head-to-toe assessment. Is that okay with you? Okay. So just a disclaimer, my patient's a little sniffly, so I'm wearing a mask and the gloves just to be on the safe side. But, okay, could you state your name?
Haley Reynolds.
Where you're at?
My house.
And do you know who the president is?
Joe Biden.
So she's alert and oriented ×3. Her gait was steady when she came in. Her affect is calm and cooperative. Her speech is clear and understandable. Her vital signs, they were normal when we tested those off camera. So now I'm going to check her scalp. All right, so there is no lesions or infestations noted in the scalp. I'm going to check inside your ear. Okay, is that tender?
No.
Okay, so there's no tenderness or no drainage inside the ears, and now I'm going to go over her eyes. So if you'll look at the light. All right, and if you will follow this to your nose. All right, so Perla was noted. Her eyes or her pupil size was equal in size. They reacted to light, and her accommodation was good when she followed the pin to her nose. Okay, and so now I'm going to look inside your mouth. She'll say, ah. All right, her uvula was midline, and her mucous membranes are pink and moist like they should be. Her tonsils were not inflamed. Her lips are pink like they should be. And so now I'm going to go over her sinus cavities. Was there any tenderness? All right, so there was no tenderness noted while going over her sinus cavities. And if you'll take your hand and go over, and if you'll blow, and if you'll do the other side. All right, so there's no nasal flaring or no drainage coming out. Now I'm gonna go over her lymphatics. Any tenderness in any of those spots?
No.
Okay, so her lymphatics, there's no tenderness and they were non-palpable. So now I'm going over her facial symmetry. It's symmetrical. So now I'm going to check her trachea. Her trachea is midline, and I'm going to go over her JVD. All right, so her jugular vein is where it should be. It's not sticking out any. And now I'm gonna go over your, I'm gonna check your carotid artery. I'm gonna palpate your carotid artery. And now I'm gonna listen with the bell side of the stethoscope. All right, so it was noted as regular +2 bilaterally, and there was no cannot say the word ever, but there was no breweries. Okay. And so now I am going to check on the patient's chest. All right, so her skin is appropriate for her ethnicity. There's no lesions, no bruising, no discoloration, nothing out of the normal. It looks pretty good. And so now I'm going to check her heart sounds, and I'm going to go over the aortic, the pulmonary, the Erb's point, the tricuspid, and the mitral valve. All right, all of them were had audible sounds. They were all +2. They were they all sounded good. There was no murmurs. There was they all had a S1, S2 beat. And now I'm going to check her apical pulse for 1 minute. All right, so her apical pulse was 72, so that was within the normal 60 to 100 range. And I'm going to use the bell side to make sure there's no brewery. All right, I didn't hear anything, so that's good. All right, one thing I forgot to do when we were on the face is check for TMJ, so I'm gonna have you open up your mouth, right, and close. Any tenderness? No. All right, so there's no tenderness, there's no clicking. So her jaw looks and sounds good. All right, so now I'm gonna go over your lung sounds. So every time I move it, if you will take a deep breath for me. All right, so her breathing sounded very clear. There was no crackles or wheezing or anything to be alarmed about. Okay, so now I'm going to have you turn your back towards me, and I'm going to check her lung sounds on the back. Deep breath. All right, so her lung sounds also sounded good on the back. There again, there's no crackles or wheezing or any drainage or fluid or anything like that to be alarmed about. Okay, so now I'm gonna have you lay on your back for me. Okay, and if you will pull your shirt up to your bra line. And now I'm gonna check for bowel sounds. Well, first I'm going to check for any lesions, bruising, discoloration, all of that. There's nothing to be worried about. She is warm to the touch. There's no tattoos marked, or there's no wounds or tearing or anything like that. So now I'm going to listen to your bowel sounds. All right, there was an audible sound in every section that we went to. I'm gonna have a seat right here. So there's an audible sound. So her intestines are good, they're working, and now I'm going to palpate the quadrants that we just checked. Any tenderness? All right, so there's no bumps or masses, no tenderness in any of the quadrants, so that's a good sign. All right, you can pull your shirt back down. All right, and you can sit up on your bottom again. Just kind of switch places. Okay, so if this was a real patient, I would check their femoral pulse, but for the sake of this, I'm not going to, but I would take 2 fingers and put it in the lower abdomen, upper leg area to check for a pulse. But now I'm going, and if this is a real patient and she wasn't wearing pants, I would check for skin discoloration, bruises, tearing, lesions, anything like that. But again, for the sake of this, we're not going to. But I am going to check her reflexes. Oops, so if you'll scoot back and hold your finger angle for me, there we go. All right. All right. Sorry. So her reflexes were +2. They were strong. They did it within a good amount of time. Again, nothing to be worried about. And so now, if you will take off your shoes for me, and if you'll put your feet up here, I'm going to check her nail beds. They look good. There's no fungus or anything. Her capillary refill was brisk and within or under 3 seconds. And I'm going to check the same for your arms. Again, there's no clubbing, anything like that. Her nail beds look good. And her capillary refill is again under 3 seconds. So her skin everywhere has been warm and dry. Her skin everywhere looks good for her ethnicity. So I'm going to check your grip and strength. So if you will, okay, and if you'll go like this, and then this, arms all the way up, and if you'll do your legs, if you'll Go like this with your ankles. And then the other way. And then if you'll put your legs up and out. All right, and if you will stand up, and we're gonna do hip abductions. Then we're gonna go this way and then this way. All right, so her strength and her grip, her range of motion is perfect for her lower and upper extremities, and appropriate for her age. So they all look good. And I'm gonna check your pulses behind your knees. I'm gonna check your dorsal pulse. All right, and the pulse in her lower extremities is +2 bilaterally. Again, everything looks good. Thank you so much for letting me do this.